Manager for Cancer Control in the West Region for the American Cancer Society. Super happy to be here with California Primary Care Association, giving us this opportunity to share some new insights on how we can move towards getting to 80% in every community. And what I'm going to talk a little bit about are uncovering barriers and opportunities on some new research that is just being released. So the findings that we'll be uncovering today is following a market research conducted by KNS Market Research during 2018 and will soon be available in the new American Cancer Society National Colorectal Cancer Roundtable Communication Guidebook. Part of the new resources that we're going to be reviewing briefly include some new findings, new population profiles, and message delivery insights that will better inform our efforts to improve colorectal cancer screening rates to 80% in every community. And we're thrilled to provide the sneak peek into this new resource. A little bit of the background of the research, and I'm not going to dive too far into that, but there were 3 phases of the research by this group, and phase 1, the objective was to measure the awareness of screening methods, understand the rationale for being screened or not screened, and uncover potential motivators to encourage screening. The second phase was to dig deeper into the unscreened population to better understand overall health perceptions, reasons behind their choice to remain unscreened, and motivators to get screened. So we're going to dive into a little bit about what the unscreened does to get us started and sort of what was uncovered during the initial phase of the research. We know that the unscreened, they care about their health. They know what they need to do to stay healthy. And also what they aren't doing, though, the majority of unscreened are not getting annual physicals or visiting their doctors for wellness checks. Those who do get physicals are more often driven by specific need, such as a refill for medication, an acute case, but they are not being proactive. So some of the barriers that were uncovered to not getting screened are procrastination, lack of symptoms, unpleasantness of PrEP, and no family history. Actually, anxiety and fear are leading emotions unscreened participants have when they think of being screened, largely related to the PrEP and procedure, but also fear of the results. So let's take a look now at some of the screening barriers and population differences. So this slide shows some of the barriers in race ethnicities. Barriers to screening are similar for Caucasian, Hispanic, African Americans, with procrastination leading. Caucasians are more likely to cite the unpleasantness of PrEP, while the Asian population's top barriers are no symptoms, family history, the doctor didn't recommend it, and more likely than others to cite the doctor just didn't recommend it and they didn't think they were of age. The young 50s, meaning the 50 to 54s, are more likely to procrastinate. The rural populations, they don't want to know if they have cancer. Females are more likely to cite unpleasantness of PrEP, no family history, and those in the marketplace insured are more likely to cite they can't afford out-of-pocket costs. So lots of similarities, but what we're going to do now is move into what could motivate screening, like in terms of the population differences. So we took a quick look right here on this slide for this, but a lot of this research was based on some of the top messaging. So what messaging can promote individuals or encourage individuals to get screened? And I want to take a look at that real quick before we dive into the actual populations. So the appeal of top messaging. So there's basically three messages that ranked like the highest during this research. Here are the three. So motivation strategies are, using key messaging is of the utmost importance. And if we can identify the population that relates best to some of these messaging, even better. So there were three types of messaging that were used in the research. And the first one is really providing the option. So that is the most encouraging, and really across all of the populations, was encouraging the options for cancer screening. The second most encouraging was sort of the right now message, which often describes one as that people, sort of motivating the individual, like, wow, I could really be having this. And the third messaging hones in on the fact that colon cancer can actually be preventive and or caught early. For others, various testing methods and the fact that they are affordable was most appealing and increased their comfort with getting screened. So basically the key takeaway here is physicians, admin, staff, whoever are working in a colorectal cancer screening program, we have to look at our messaging and how we are addressing the patients and tailoring it perhaps for a more positive outcome. Okay, so now we're going to take a look and dive a little bit deeper into those populations for us. So here is the unique challenges and opportunities for the young. So the challenges, again, procrastinating, more likely to cite procrastination, no time, not thinking they are old enough as barriers, more likely to be uninsured, more likely to go to the urgent care, a pharmacy, or ER when sick. What opportunities does that pose for us? So placing a higher importance on screening, more often desire health info from the doctors in the health portals, greater trust in receiving health info from family and government health organizations, and message how screening can prevent colon cancer by removing polyps. So to dive just a little bit further into this population, I'm going to highlight just three aspects of these profiles. So again, top barriers for the unscreened young: procrastination, no symptoms, and the doctor didn't recommend it. However, using the three messaging on the left-hand side of the screen here, you can see the likelihood, if this messaging was used, it could actually increase almost 10% the likelihood that the individual will opt to and get that screening done. That's a huge jump. So we really, again, have to look at the messaging and tailor it. This group has put off screening most often due to being busy, with a large share currently working full-time. Communicating the ease and simplicity of at-home tests is an important part of motivating this group. Elements of the right now message can go a long way to educate those who are not being screened due to lack of symptoms. Okay, let's move on to our next population, and that is the Asian. So some of the unique challenges and opportunities here. The challenges, we've heard that they feel there are no symptoms, the doctor didn't recommend it, and there are no family history leading to the barriers. So a little bit different on what we just saw in the 50-year-old. So they are more likely to cite the doctor didn't recommend or not thinking they are of age as barriers. What type of opportunities can we look forward to? Increasing awareness and education on colorectal cancer screening is the most motivating. Message how screening can prevent colon cancer by removing polyps. Materials at healthcare facilities or news report stories that are viable information channels, and greater trust in receiving health info from government health organizations and insurance companies. So a little bit diving deeper into the profile of this population. again, top barriers: no symptoms, procrastination, no family history, and the doctor didn't recommend it. What I found interesting in this population is, notice the messaging potential to increase screening is almost equal. So all those messaging are around 20% or so, which would still indicate about a 7% increase in screening. So for this population, maybe looking at and implementing these type of strategies across the board would help the population. The lack of symptoms is the leading reason this group has not been screened. Putting off screening due to fear of the test is also a top barrier. Messaging that provides options performs well because it addresses the fear element, but it's also important to communicate elements of the right now message to address lack of symptoms. Over half this group is doctor averse, and only 4 in 10 go to the doctor for checkups. So alternative channels are needed to engage this group. All right, let's see. Next population, the African American population. So procrastination, again, the leading barrier, and they're more likely to cite fear of results as a screening barrier for people in general. Opportunities here: increasing awareness, education on screening is most motivating, greater trust in receiving health information from government health organizations and insurance companies, and message how screening can prevent colon cancer by removing polyps. So a little bit deeper dive into their profile. Again, barriers: procrastination, cost concerns and prep concerns are some of the drivers under procrastination. The doctor didn't recommend it, there's no symptoms, and there are prep concerns. Here, any of the three messaging appear to be equally effective, almost 6, 7, 8% increase using some of these messaging strategies. This group has a higher baseline likelihood to get screened compared to others, but procrastination due to cost and or prep concerns is a key barrier for this group. Messaging alternative tests that are affordable would have a positive impact on future behaviors. Aside from healthcare providers, health websites, emails, and portals are viable messaging channels. We're going to take a look at 2 more and we'll be wrapping up. So UnScreened Hispanic, there are unique challenges and opportunities. Main challenges is procrastination is driven by fear or being busy, or are the leading barriers. No symptoms and also no family history. The opportunities: increase at-home options, both alleviates fear and minimizes time, commitment, concerns, and increasing awareness, education on colorectal cancer screening through trusted sources, such as the American Cancer Society. Let's dive in a little bit deeper here. Okay, so some of the barriers, again, procrastination, the fear of the test is high, and also being busy. There's no symptoms and family history. While there is potential across all three messaging, please note that offering the option 1 offers the greatest screening impact here. Not quite doubling it, but there is, by providing that option, this could lead to greater screening compliance. So procrastination driven by fear or being busy is a top barrier for this group. This group is more likely than the total base to still be working and have young children. So easy at-home options both alleviates fear and minimizes time, commitment, concern. Half go to the doctor for regular checkups, so healthcare professionals presenting alternative testing can be helpful. The other half, though, alternative channels are needed to engage this group. And then finally, we're going to take a look at rural populations. So major challenges for this population: the procrastination, no symptoms, and no family history top the barriers. They're more likely to cite not wanting to know if they have cancer as a barrier to screening, and they're less likely to get annual physicals. And this could be a situation where there's lack of access to care as well. Opportunities, greater awareness for the FIT or the DNA test, lower prices, better insurance coverage is a leading motivator, and message on how screening can prevent colon cancer by removing the polyp. So a little bit deeper dive here. Again, there's the barriers, procrastination. They're busy and they have PrEP concerns. There's no symptoms, no family history, and can't afford out-of-pocket costs. As you can see here in the likelihood of getting screening, still the three messaging are fairly similar, although the first offering the options will create more positive outcome. Procrastination driven by being busy and or worried about the PrEP are top barriers for rural dwellers. Knowing there are alternatives, easier tests that can be done on their own time at home is very motivating to this group. The majority of this group are doctor averse and do not go to the doctor for regular checkups. So alternative sources such as national health organizations may be helpful in reaching this group. I hope you found that information helpful, and again, there'll be an opportunity to see all this in a live document very soon.